Hello everybody, this is Dr. Jean-Guy coming back here for the tip of the week. This week we have a very important question that I would like to answer, which is about scoliosis. And for you parents out there, you might have heard the term, you might not really know what that means. I'd like to educate you on that today a little bit. What is a scoliosis and can that be corrected? And how would you know that if you have one or if your children, if they have one or not? Number one is what I'd like to say about that is the only way that you can find out if truly a child has a scoliosis would be to have an x-ray done of their spine. And us chiropractors, this is what we specialize into finding out if a child will have a scoliosis or not. And one thing that I can tell you that it's been sometimes people were told that they have a scoliosis, but truly what they have is they have a postural problem. If you have a bad posture, when you take an x-rays, it can look like you have a scoliosis, but you don't really have one. So scoliosis by definition is if you look at the spine from the side, you guys can see that from the side, right? If you're looking, you should have some three curvature when you look at the spine from the side, in the mid back and in the lower back. But from the front, it should be straight from top to bottom. So when a person has a scoliosis, they're gonna have some deviation of the spine from side to side. And that is what they call the scoliosis. The scoliosis could be just in one area, like between your shoulder blades, or sometimes it could be in two areas between your shoulder blades and also right above your hip. And they call that a double curve. But again, I just want to, just want you to know that the only way that you would know that as a parent would be to have an x-ray done of your child. I guess the pediatrician, not the pediatrician itself, but they could refer you out to have an x-ray done. But us here at our chiropractic office, we do that every day. And truly the only way to know would be to take an x-rays. And then we can tell the difference if a person has a postural problem or if they truly have a scoliosis. If they have a postural problem, it can totally be corrected. So we already know that for a fact. And if a person has a scoliosis, there's some of the scoliosis that you'll be able to improve. There's a lot of variables, which today we're not going to have time to talk about that. But in some cases, you will be able to improve those chiropractically. In other cases, a better approach would be to combine exercises with bracing, which there's also different types of bracing. And again, if you are interested into, or if you think that your kids have a scoliosis, the logical step to do would be to have an x-ray done of their spine and then to be able to determine that. And probably the most important thing that I want you guys to get out of this is, at some point in time, it's important for all the kids, to have their spine checked and to make sure that they don't have a scoliosis. And many times, even at school, it will be missed. They just have them bend over and they look at their back and then they make a decision to see if they have one or not, if they have a curve in their spine or not. A curvature in your spine could just mean that you have a postural problem, and a postural problem can totally be corrected chiropractically again. And then if you do have a scoliosis, then you want to make sure that you're on it, as fast as you can, because this will be more predominantly in girls that are between the age of 12 to 17 years old, and they're called idiopathic scoliosis, which means that they don't really know why they have them. But the fastest that you can, that you can get on it, that that a person has a scoliosis and it's a true scoliosis, your chances of being able to minimize the damage from that scoliosis going to be greatly enhanced if you do something about it right away. So anyway, I just want to give you the tip of the week on scoliosis. And for you guys to know that we are here for you if you have a family and you have children and little kids there, and as they're getting older and they start doing, lots of different things with sports, it's always a good idea to have their spine checked and to make sure that, if they are developing scoliosis, we can find out about it right away. And then also for the kids that they've had some trauma to their spine and they have some postural distortion, like their head is shifted over like so, those are the things that are not normal and can definitely be corrected and help with chiropractic care. Thank you very much. We'll see you later.